The drug I was assigned for this interview is theophylline. I had never heard of this drug before, so it was interesting to learn some new things throughout the process. I scheduled an appointment at the Meyer Pharmacy and met with a man named Jamie, who was really helpful, and he went above and beyond everything that I asked him to do. So to get to the questions, theophylline is part of the xanthine class of drugs because it is a xanthine derivative and it functions as a bronchodilator. Typically it's used for asthma, COPD, and other respiratory issues, but aside from that, it can be used for bradycardia or sleep apnea. When taking this drug, there are a few minor side effects. However, Jamie, his opinion is that they don't see many people coming in with these issues. When they do occur, though, it is usually something along the lines of headache, insomnia, nausea, vomiting, and possibly some heart issues because it is dealing with oxygen intake. Overall, the most common complaint he has heard is gastrointestinal discomforts because people take their doses too close to meal times. The patient also needs to know that there are a few types of drugs that have interactions with theophylline. He listed off that there are multiple psych medications, antibiotics, and muscle relaxers that may interact because they use the same enzyme to break down the drug, which is CYP1A2. He also mentioned that the doctor should be aware of any duplications in therapies, which would be other drugs the patient is taking for the same problem. He couldn't think of any interactions that would be extremely dangerous, though. When it comes to actually taking the drug, it is usually taken in the form of an extended release tablet. And with this tablet, it is important to schedule it around meal times because absorption rate will depend on whether the stomach is full. So the tablet should be ingested either 30 to 60 minutes prior to eating or about 2 hours after. And he also said it should be taken with a full glass of water. Currently, the drug is not very commonly given. He explained this is due to the fact that other better drugs are available, specifically inhalers that have taken its place, such as Spiriva and Advair. He even said that he didn't believe there was any in stock when I came to see him. So because of its decreasing popularity, many insurances aren't covering this drug anymore. Considering this and the fact that the drug costs $11 per tablet, many people wouldn't want the drug anyway because they can't afford it. For my own research, I did find that 65% of Medicare prescription plans do cover this drug, so that's a little more than he said. Generally speaking, the pharmacist I spoke to did not have much first-hand experience with this drug. He felt that there were multiple better options, and from what he has seen, people tend to like those other options better. If you are prescribed this medication, however, his recommendation is just to make sure you are being aware of your meal times and when you are taking the tablet, and also getting the full glass of water as well.